Breathing. It's not something you think about a lot, unless you're one of more than 15 million Americans with asthma. But with proper treatment, most people with asthma can do all the things they want to do. When your doctor told you you had asthma, you may have been surprised. Many people who have asthma and their family members think they've got a chest cold that won't go away. Or if they cough when they exercise, they may think they're just really out of shape. The truth is, the symptoms of asthma can be similar. You've probably felt things like shortness of breath, wheezing, tightness in your chest, nighttime cough, or a cough that lasted more than a week.
I woke up from a really sound sleep, and I was wheezing a little bit earlier in the day, but at about 2:30 in the morning, 3 o'clock, I just woke up and I couldn't breathe. It felt like someone was sitting on top of me, and they were squeezing air out of me, and I couldn't get anything in.
The cough, it hurts the chest after a while, and feels like someone's stabbing me with a knife. Just a lot of school, which then I get behind and have to make up all the work in a couple of days, went into a couple weeks' work.
It's usually triggered off by being very moody, very fussy, irritable, loss of appetite. Then you start feeling like you're congested.
But your doctor can tell the difference. You'll be asked questions about your medical history, and you'll be given a physical exam. In addition, your doctor will use a device called a peak flow meter to measure how much air you're able to blow out of your lungs and how fast that air is traveling.
Great.
The result of this test tells your doctor how well you're breathing. With all this information, your doctor is able to diagnose your asthma condition and get you going with a treatment plan that will help you manage the condition and get on with all the things you want to do. One of the first things you need is knowledge. What is asthma, and how is it affecting you? Asthma is what is known as a chronic disease. In other words, it's not like a cold or a flu that makes you cough but only lasts a few days or even a couple of weeks. Asthma is a disease of your bronchial tube. It can't be cured, and you don't just get over it. But you can control it with a simple treatment plan. Dr. Gary Rachelefsky is a clinical professor in the Department of Pediatrics at the School of Medicine at the University of California in Los Angeles. He's an expert on asthma, and for over 24 years has been helping people, especially children, manage their asthma while staying active.
If you have asthma, you're not alone. Millions of people develop asthma each year. You know that it's not contagious. You can't catch asthma from someone else. But we still don't know exactly what causes it, but it does tend to run in families. We do, however, know how to help you take care of it. That's why you'll find people with asthma playing soccer, swimming, dancing, even competing in the Olympics or playing professional sports. Asthma management should become a simple part of your daily routine, like brushing your teeth. For most people, daily management controls their asthma so they're able to do the things they want and live normally. To understand what I mean, let's take a look at how your lungs work.
Take a deep breath and let it out. You just performed a very complex operation. In fact, you're still doing it and you're not even thinking about it. As you breathe, you're recharging the cells in your body with fresh oxygen and taking out the gases you don't need, specifically carbon dioxide. It's a fast, efficient system, but it's amazingly complex. The air you breathe enters your body through your nose and mouth and passes through your trachea, the long tube in the front of your neck. As it comes into your lungs, it moves through a dense network of large and small tubes called airways, or bronchial tubes. At the end of these tubes are air sacs that look like tiny clusters of grapes. The walls of these sacs are very thin and allow the oxygen you breathe in to move directly into your blood, where it circulates through your whole body. As you breathe out, the system reverses as your bloodstream brings carbon dioxide back to the air sac, where it moves up the airways, into your trachea, and finally out of your body. The whole process has taken just seconds, and it's about to start all over again. But sometimes there's a problem. If you have asthma, the lining inside your airways becomes easily inflamed, that is, irritated and swollen. A number of things can trigger this reaction. Something you're allergic to, like dust mites, grass, pollen, mold, or pets. Irritants like tobacco smoke, hairspray, or paint fumes. Exercise. A chest cold, viral infection, or even cold air.
What really triggers an asthma is weather change. Then comes dust and things that are in the air like pollen, and also there's diesel cars. They really trigger it because it's like I guess you can't breathe when it's touching. The weather triggers my asthma. The wind, animals, cats, and horses really bad hay, and newly cut grass, and stress.
When you come into contact with one of these triggers, the lining of the bronchial tubes becomes inflamed, swelling so that you feel like you're breathing through a straw. In addition, mucus released to fight off the irritating trigger can clog the airways, just as the muscles in the airways begin to squeeze and tighten down. The result is an asthma attack or episode.
Your doctor may not be able to cure your asthma, but he or she can provide you with the tools and skills to manage asthma with these goals in mind. You should be able to breathe normally most of the time. You should be able to maintain normal activity levels, including exercise. You should have few or no asthma attacks or episodes. You should only rarely miss an activity, work or school day, or even a night's sleep. You should have no side effects from your treatment. That means you can breathe easier, be healthier, and do the things you want. All it takes is a little effort.
When you were diagnosed with asthma, your doctor began working with you to develop a treatment program designed specifically for you. There are 4 main parts to this program. The first is education. That's what you're doing right now. It's important to learn about this disease and how it's affecting you. The second is medication. Your doctor may prescribe 1 or more medications for you to reduce the inflammation in your airway, relieve the symptoms of asthma, and help you to breathe more easily. Your doctor may also want you to keep track of how well your lungs are working every day. This is called measurement of lung function, and it's the third part of a typical asthma treatment plan. To do this, you'll use a device called a piss flow meter. We'll show you how in just a few minutes. The fourth part of your plan may be environmental control, getting you away from things you're allergic to, or things that irritate your lungs when you breathe them in, such as pollen, dust, animal hair or feathers, cigarette smoke, the effects of colds and flu, certain medications. At some point, your doctor may recommend allergy injections to protect you against harmful allergens that trigger your asthma.
When you came to see your doctor about your breathing problems, your lungs were probably inflamed. Even if you weren't having symptoms right then, your airways were probably irritated and swollen. As part of your therapy, your doctor may want to give you medication to reduce the inflammation and get your airways healed and back to normal. This kind of medication is called an anti-inflammatory. It is frequently prescribed as an inhaled medication. In other words, you breathe it in. This way, the medication is delivered directly to your airways, where it can go to work right away. There are a number of different devices that you can use to help you get just the right amount of medication. We'll talk about each of these devices and how to use them later on in this program. The other type of medication is a bronchodilator. A bronchodilator will help you when you're having trouble breathing by relaxing the tightened muscles in the airways. You can breathe in the air you need. It is given as an inhaler, as a tablet or capsule, or as a liquid medicine that you swallow or inhale through a nebulizer or breathing machine. Whatever anti-inflammatory medications the doctor has prescribed, it is very important to take them regularly as directed. Many people stop using their anti-inflammatory medications when their breathing is better. This only allows the airways to become irritated again. Remember, Anti-inflammatory medication helps control asthma. Bronchodilators help relieve asthma episodes when they happen.
You'll be able to tell a lot about how well your airways are doing by how you feel. But sometimes your airways are becoming inflamed and you don't know it. The condition can get worse for hours or even days before you realize that something is wrong. But there is a way to see how well your lungs are functioning, measuring how fast you can blow air out of your lungs after a deep breath. This is done using a peak flow meter. This is the peak flow meter we talked about earlier. You can use this small handheld device at home, at school, or at work to measure how much air you can force out of the large airways in your lungs. Colleen Rumlung is a nurse practitioner at the National Jewish Center for Immunology and Respiratory Medicine in Denver, Colorado. She specializes in asthma.
Peak flow meter is one of the best tools for helping in asthma. It can give you an early warning if there's a problem. By using your peak flow meter regularly and noting any other early warning signs or symptoms, such as a runny nose, slight cough, or itchy chin, you will be able to discover problems early on, enabling you, for instance, to change things in your environment that may trigger your asthma. This can help you and your doctor check how well your asthma is being controlled and allow your doctor to make changes or adjustments to your medication if necessary. We're going to show you how to use the peak flow meter and how to tell how well your lungs are doing. First, the meter itself. They come in a variety of shapes and sizes, but they all basically work the same. Stand up and move the sliding indicator all the way to 0 at the bottom of the meter. Then take a deep breath and put the mouthpiece in your mouth, fully closing your mouth around it. Now blow as hard and as fast as you can. Write down the number where the indicator has stopped. Then do the whole thing. Move the indicator back to 0, blow and record 2 more times. Now take your highest number and put that in your peak flow diary. This is a chart that you'll keep every day to track your asthma symptoms and your lung function. Compare that number to your personal best. That's the highest number you've been able to get when your asthma is under good control. After you've been using your peak flow meter for 2 weeks, your doctor will help you determine your personal best. Of course, you won't have a personal best number at first. Until you do, your doctor will give you a number to work with based on your height, age, and sex. If your reading today is 80 to 100% of your personal best, you're in the green zone. That's great. Your asthma is under control, and you're ready for whatever you want to do. If your reading is 60 to 80%, yellow zone, caution. You may have inflammation in your airways. Make sure you and your doctor have discussed what to do with this asthma. Make sure you are following the action plan you and your doctor have agreed upon. Usually, you would use your reliever, your bronchodilator inhaler immediately, and then use your peak flow meter again in 10 to 20 minutes. Your doctor may want you to take more medication for a day or 2, or he or she might just adjust the medicines you're using every day. If your reading is below 60% of your personal best, you're in the red zone. You're having an asthma episode, or you are very close to it. Use your bronchodilator as directed by your doctor. Wait a few minutes and take a new peak flow reading. If you don't get into green or yellow zone, call your doctor right away. Always follow the action. The percentages we've discussed are just guidelines. Your doctor may use different percentages for your zones. 3 colors, 3 clues to tell you how your lungs are doing. You should take your peak flow reading every morning and every evening, and be sure to record your readings on your diary, along with any other information your doctor has requested. And take your diary and your peak flow meter with you when you visit your doctor.
It is important to keep your peak flow meter clean and in good working condition. A little soap and warm water is usually sufficient to keep it clean. Shake it out well and let it dry. Some meters can be put in the top rack of a dishwasher. Check the instructions that come with your meter to be sure.
Medicines, meters, devices, diaries. It may all seem a little confusing right now, and maybe more than you want to do. But remember, it's all new to you. Before long, it'll just be a few minutes a day. Your lungs will be strong. You'll be breathing well and feeling good. If you have any questions or problems, be sure to ask your doctor. Remember, he or she is your partner in asthma care. The treatment plan is for you, and only works if you agree to follow it. With little effort, you can get your asthma under control. You can do all the things you want to do.
You also probably have a special device for inhaling your asthma medication. You may have a metered dose inhaler, a metered dose inhaler with a spacer or holding chamber, a nebulizer. For information on your asthma device, please find the symbol or small picture of it on the screen. Now fast forward the videotape until you see that symbol in the bottom right-hand corner of the screen for specific information on your device. Your doctor has prescribed an asthma treatment medication for you, which you will take by using a metered dose inhaler. Metered means measured or regulated. Every time you press down on the medication canister in your inhaler, it will deliver a measured or metered dose of medicine, which you will then inhale. Your medication may be an anti-inflammatory or a bronchodilator, or your doctor may have prescribed both medications, which means you have two inhalers.
No matter what type of medication you have, the inhaler works in the same way. It is important to follow the steps carefully to make sure all of the medication reaches your lungs where it's needed. There are two methods for using an inhaler. The first is called the closed mouth technique. First, shake the inhaler well and remove the cap from the mouth. Breathe out gently, expelling as much air as you comfortably can. Then place the mouthpiece in your mouth, holding the inhaler upright, and close your lips around it. While breathing in deeply and slowly, fully depress the top of the canister with your index finger. Continue breathing in. Hold your breath for as long as you comfortably can, about 5 to 10 seconds. Then remove the inhaler from your mouth, release your finger from the canister, and breathe out. Most doctors today recommend a different method for using a metered dose inhaler, the open mouth technique. Here's how it's done. First, shake your inhaler well and remove the cap that covers the mouthpiece. Breathe out well as you tilt your head back slightly. Then place the inhaler 1 or 2 inches away from your mouth. Begin to breathe in as slowly as you press down on the canister. Then continue breathing in for 3 to 5 seconds. Hold your breath and count to 10. Then breathe out gently. If your doctor has prescribed more than one inhalation or puff, wait a minute, and then repeat the process. Take the inhaler again, just make sure that the medication is well mixed. Then breathe out, tilt your head back, place the inhaler 1 or 2 inches from your mouth, breathe in slowly, 3 to 5 seconds as you press down on the canister. Hold your breath for 10 seconds, and breathe out. Your doctor also may recommend that you rinse your mouth out with water or mouthwash after using your inhaler to get rid of any medication that may have stayed in your mouth. Your inhaler case should be cleaned at least once a day. Just remove the medication canister and rinse the plastic casing cap in warm running water. Then dry them. Put the canister back in the case and put the cap on. That's it. Pretty simple, huh? Take as many inhalations or puffs as many times a day as your doctor has directed. But you should never use your inhaler more than the number of times per day that you and your doctor have agreed upon. The small size of your inhaler allows you to take it with you to work or school. However, please be aware that many school systems require special permission forms and procedures in order to use inhalers at school. Check with your school to find out what you need to do before the start of every school year.
Your doctor has prescribed an asthma treatment medication for you, which you will take by using a metered dose inhaler and an additional device called a spacer or a holding chamber. Metered means measured or regulated. Every time you press down on the medication canister in your inhaler, it will deliver a measured or metered dose of medicine, which you will then inhale. The spacer or holding chamber goes between you and the inhaler. It helps to make sure that the medication doesn't just spray into your mouth and stay there. Remember, you want the medication to go into your lungs where it can work. With a spacer, the spray actually comes into your mouth under less force, so you can breathe more of it into your trachea and into your airways where it's needed. It also reduces the amount of propellant you inhale from the medication canister, which can irritate your throat and make you cough. First, remove the cap from the inhaler and insert the mouthpiece of the inhaler into the rubber ring at the end of the spacer. If your device looks like this, you must first connect the mouthpiece to the reservoir bag. To do so, line up the locking tabs on the mouthpiece with the hole in the reservoir bag. Then push in and twist to lock. Next, gently untwist the reservoir bag to open fully. Shake the inhaler well before placing its stem in the mouthpiece, making sure that the stem is seated in the center of the mouthpiece. If your spacer has a mouthpiece, insert it into your mouth between your teeth and close your lips around it. If your spacer has a mask, press it snugly against your face so that your mouth and nose are covered and the edges are sealed to prevent leaks. Now press down on the medication canister. This sprays the medication into the spacer. Breathe in normally for 3 to 5 seconds to inhale the medication. If you make a whistle noise, then you're not doing it correctly. If you're using a mask, you should see the diaphragm move with each breath. This shows you have a good feel and the medication is being inhaled properly. If your doctor has prescribed more than one inhalation or puff, wait a minute, and then repeat the process. Shake the inhaler and spacer together again. This makes sure that the medication is well mixed. Then place the mouthpiece in your mouth or fit the mask around your mouth and nose. Press down on the medication canister and breathe in and out normally for 6 breaths.
That's it. Pretty simple, Only take the number of inhalations or puffs as often as your doctor has directed. And remember, the small size of your inhaler and spacer allows you to take them with you to work or school if necessary. However, please be aware that many school systems require special permission forms and procedures in order to use inhalers at school. Check with your school to find out what you need to do before the start of every school year. This is a nebulizer with an air compressor. It was prescribed by your doctor to allow you to inhale a liquid medication from your lungs. It produces a fine aerosol, or mist, which is a blend of air and medication that goes directly into your airways. There are several different types of nebulizers available, but their basic operation is the same. We're going to show you how to use a nebulizer, but be sure that you read the manufacturer's instructions that come with your unit.
First, you want to put the compressor on a table near you so that you can reach the controls easily while you're using it. Then take the tubing and unwind it. Connect one end of the tubing to the compressor. Your medication may have been supplied to you as a pre-measured dose, an ampule, or in a bottle with an eyedropper. Take 1 dose of your medicine, measuring if necessary, and put the medication in the nebulizer itself. Some types of nebulizers require that you remove the top to do this, while others allow you to release it directly into the top. Check your unit's instructions. Replace the top of the nebulizer if you've removed it, and attach the tubing to the air intake on the bottom on the nebulizer. The nebulizer can be used with either a mouthpiece or a mask. Attach whichever one your doctor recommends to the nebulizer outlet. This may be on the top or side, depending on your model. Make sure that the on-off switch is in the off position and plug in the unit. Now make yourself comfortable near the unit. Some nebulizers must be used sitting up, while others can be used sitting up or lying down. Again, check your unit's directions and your doctor's recommendations. Place the nebulizer mouthpiece between your teeth and close your lips around it. Or, if you're using a mask, place it over your nose and mouth. The elastic band goes around the back of your head to help hold it in place. Turn the on-off switch to the on position. Now just relax. Inhale slowly and deeply through the mouthpiece or mask, and exhale through the mouthpiece or mask. If your doctor has told you to hold your breath for 5 to 10 seconds after you inhale, be sure to follow these instructions. When your medication is all gone, turn off the machine and remove the mouthpiece or mask. Some patients and their families have been taught to do their nebulized treatment using blow-by instead of a mask or mouthpiece. The blow-by method means just that. The mask or mouthpiece is removed from the nebulizer and the medication is blown in the patient's face. This is an ineffective way of giving a treatment. If a nebulizer with a mask delivers less than 10% of the total amount of medication to the airways, the blow-by method will deliver even less because the inhalation is not focused on the nose or the mouth directly. Much of the medication escapes to the surrounding air. Often the blow-by method is used with young children during hospitalization. While a child is in the hospital, he or she is most likely not very active. However, once the child is better and returns home, the level of activity increases dramatically. The parents then end up chasing the child around the home trying to give a nebulized treatment. Nebulized treatment should be given with a mask or a mouthpiece for the most effective delivery of the medication to the airway.
It's very important to keep your nebulizer and all its parts clean. You should clean them before you use the unit for the first time and rinse them well with hot water after every time you use it. Then, at least once a day, thoroughly clean them. Follow the manufacturer's instructions for cleaning, or use the simple method.
Disconnect the tubing from the nebulizer. Now take the nebulizer completely apart and wash the pieces, except the tubing, thoroughly in hot water with dishwashing liquid. Rinse the pieces in hot water and place them in a vinegar solution. 3 cups hot water to 1 cup vinegar for 30 minutes. Then remove, rinse, and air dry. Your nebulizer is now clean and sterile. Some nebulizers can be washed in the dishwasher. Check your unit's instructions. Your compressor may need a new filter once a month or so. Check your unit's instructions.
If you have any problems using your nebulizer and compressor, review these directions and check the instructions as they come to your unit. Your doctor and his or her office staff know this equipment well and can answer any questions you have about using it. The medical equipment company that supplied your nebulizer and compressor will also be able to help you with any questions you may have about this.
This program on Breathing Easy, getting the most from your asthma medication, is brought to you by Key Pharmaceuticals. The opinions expressed in this discussion are solely those of the participants and may not reflect those of Key Pharmaceuticals Incorporated.